All right, so it's really good to be here once again. Without wasting time, today we'll be talking about ulcer. I'll be telling you the meaning of ulcer. I'll be telling you the signs and symptoms, the causes, the risk factors, the preventions, and how ulcer happens. Now, when you hear the word ulcer, what comes to your mind? But before then, have you ever had any injury before that is on any part of your body? Have you ever had a sore on any part of your body? You know how it feels like, right? That is exactly how ulcer is in the GIT. Now, ulcer is an opening across the GIT. It can either be in the esophagus, in the stomach itself, or the duodenum. Now, ulcer is classified according to these three that I just mentioned. That is based on the location. You can have esophageal ulcer, you can have gastric ulcer, that is the stomach itself, you can have duodenal ulcer. Now, what are the causes of ulcer? Bacteria. Yes, bacteria. When you have recurrent bacterial infections of the GIT, it can predispose you to having ulcer. You have stress. If you are the type that is always so stressed out, definitely you will always skip meals, you won't always eat well. You can be prone to having ulcer. We have familiar tendency. That is, if there is someone in your family that has had ulcer before, there's a tendency that you might also be at risk of developing ulcer. Yes. We also have age. Okay, age should be under risk factors now. All right, so let's quickly look at the risk factors because I'm actually mixing them up. So let's look at the risk factors immediately. Now we have age. Those that are the elderly ones are actually prone to having ulcers than the younger ones. I guess we all know about this. Now, smoking. When you smoke a lot, excessive smoking, excessive intake of alcohol, too much spicy food. When you eat spicy food a lot. Okay, sorry about that. I'm actually laughing because I'm so guilty of this part. I take in spicy food a lot. Like, I don't eat if the food isn't spicy. So it's actually a habit I need to cut off. Yes, I need to cut it because my health is my priority. All right, so we have other factors like risk factors like genotype. Okay, not genotype right now, I'm sorry. Blood group, rather. If you are the blood group O, yeah, you're at risk of having ulcer. Now, this ulcer, how does it happen? Now, any of the causes that I listed will cause erosion of the GIT mucosa. When I mean erosion, you all know what erosion means now, right? That is when there's washing away, peeling off. It keeps on, the GIT mucosa keeps on washing off rather. Mucosa, that is the lining of the GIT. Then the GIT simply means gastrointestinal tract. Okay, so when there's an erosion of the GIT. Now, how does this happen? Those causes that I listed above now stimulates histamine. Then that histamine that has been stimulated will lead to the secretion of gastric acid. We all know that there is an acid that is found in the GIT, which is the gastric acid, that is the HCl, hydrochloric acid. Hydrochloric acid is found in the GIT, which helps in digestion of food. Now, when these causes triggers the release of GIT, instead of the release of GIT acid instead of food, now it leads to auto digestion. Now, this continuous auto digestion leads towards erosion of the gastric mucosa. What I'm simply trying to say here, you have to understand this today, whether you like it or not. All I'm simply trying to say here is that the causes listed above will lead to the secretion of histamine. And that histamine will lead towards further secretion of the GIT acid. Now, the GIT acid in the stomach, that is the hydrochloric acid, which helps in the digestion of food. But now there is no food to break down. There is nothing to break down. Now, what happens? There is autodigestion. When there is autodigestion, that acid causes erosion of the gastric mucosa. We all know what acid can do to the body. So imagine acid in the GIT when there is no food. Now, it causes erosion of the gastric mucosa. Now, when this happens continuously, recurrently, now it will lead to hemorrhage, that is bleeding. That's why most times when you see that ulcer patients, when they defecate, there is always blood on their feces. That is when they have those crises. There is always blood in their feces. That is actually what causes it. Now, we've seen how it happens, right? Okay, you're welcome. Now, we'll be looking at the prevention. How do we prevent this? Okay, before we look at the preventions, let's look at the signs and symptoms. Now, what are the signs and symptoms of ulcer? Obviously, there will be pain. If you have any injury on any part of your body, you find out that there is pain. It's always very painful, right? You experience pain. So that's what happens as well. You have abdominal pain. Then you have this burning sensation. You've seen, I don't know if you've ever seen anybody that maybe had an acid poured on them. You see, there's this burning sensation and there's this scar it leaves. That is what happens down. That is what happens in your GIT. Now, there will be anorexia. Definitely, you wouldn't have appetite to eat because you'll be scared of eating. Especially when you're taking peppery food. You find out that there is this burning sensation there. Now, and if you don't eat, it will lead to weight loss. All these things I'm mentioning are the signs and symptoms. It will lead to weight loss. Also constipation. Now, quickly, let's look at the preventions. Now, what are the preventions of ulcer? How do we prevent ulcer? It's very easy. Preventions are very, very easy. And that's why they keep on saying that prevention is easier and cheaper than cure. Yes. Because the prevention is just to prevent the causes listed above. It prevents excessive intake of alcohol. You avoid smoking. You make sure you regulate your stress level. Because it's only when you're healthy you can actually chase whatever it is you're chasing that is making you be stressed out, Also, reduce excessive intake of those analgesics I listed. Diclofenac, ibuprofen, Felvin, they are anti-inflammatory drugs. Please reduce them. Then, I guess with this, we'll be able to oh my god, thank you very much for listening.